Globally, reported cases and deaths from COVID-19 are continuing to decline, with reported weekly deaths at their lowest since March 2020. But these trends, while welcome, don't tell the full story. Driven by Omicron subvariants, we're seeing an increase in reported cases in Americas and Africa. The South African scientists who identified Omicron late last year have now reported two more Omicron subvariants, BA4 and BA5, as the reason for a spike in cases in South Africa. It's too soon to know whether these new subvariants can cause more severe disease than other Omicron subvariants, but early data suggests vaccination remains protective against severe disease and death. The best way to protect people remains vaccination, alongside tried and tested public health and social measures. This is another sign that the pandemic is not done with us, and there are some clear takeaways. First, vaccinating at least 70% of the population of every country, including 100% of the most at-risk groups, remains the best way to save lives, protect health systems, and minimize cases of long COVID. Availability of vaccines has improved significantly, but a combination of lack of political commitment, operational capacity problems, financial constraints, and hesitancy due to misinformation and disinformation is limiting demand for vaccines. We urge all countries to address these bottlenecks to provide protection to their populations. Second, testing and sequencing remain absolutely critical. The BA4 and BA5 subvariants were identified because South Africa is still doing the vital genetic sequencing that many other countries have stopped doing. In many countries, we're essentially blind to how the virus is mutating.